My name is Hung, and me and Veronica are going to be talking about onchocerciasis. So onchocerciasis is commonly known as river blindness. It's called that because the vector, the black fly, breeds in fast-flowing rivers, and one of the consequences of untreated river blindness is it causes blindness. Some signs and symptoms is severe itching, nodules and lesions in the skin from the larvae, and changes in vision. If left untreated, it can cause permanent skin disfigurement, iconically known as leopard skin, and irreversible blindness. You can see the clouding of the cornea on the left from untreated onchocerciasis. On the right, you can see the iconic dyspigmentation leopard skin. So why we chose this disease, I actually heard about this disease on a show called Monsters Inside Me on Animal Planet. I highly recommend it. It's an interesting watch showcasing many rare diseases. River blindness is considered a neglected tropical disease, so disease of the poor. It affects more than 25 million people internationally. It's the second leading infectious cause of blindness over another eye disease called trachoma. Over 600,000 people worldwide became blind because of this disease. The river blindness is mainly an endemic disease seen in Africa, but it's also seen in Latin America and Yemen in the Middle East. 95% of the cases are in Africa, though, and controlling and treating people affected by this disease. And the core intervention is called a community-directed treatment with ivermectin, which is an anti-parasitic medication, which is the main form of treatment for this disease. This is a blown-up map of Nigeria. You can see the Niger River that flows through the lower third of Nigeria, where there's higher prevalence of the disease. You can see the disease has higher incidences around bodies of water. It kind of follows the rivers around here on the map. It's very prevalent in usual rural settings, especially agricultural areas where, these places are near bodies of water. And it's significant because 30% of the people in Nigeria are involved in the agriculture industry. It's kind of the main way of life for most of the people in the state. So basic overall overview of Nigeria healthcare. Basically, there's 192 million people in the state, which is the seventh most populated country in the world. And there's not enough health professionals to accommodate for the size of this community. And even then, most of the healthcare workers are concentrated in the southern area of this country, where it's in more urban places, so away from where river blindness would be prevalent. Here shows kind of a list of the leading causes of disability in Nigeria. You see like nutrition deficiencies, which are common to third world countries where nutrition is more of a issue. Blindness and vision impairment actually come in sixth. And these are all caused by communicable and non-communicable diseases. So river blindness is a significant factor in the health in Nigeria.
So unfortunately, at least 25 million people are infected with onchocerciasis worldwide. Upwards of 50% of adults living in West Africa at one point were infected with the illness. However, thankfully, the goal. Thus, our PICO question becomes, does the use of ivermectin as opposed to traditional larvicidal treatments more effectively reduce the incidence of onchocerciasis in African Program for Onchocerciasis Control countries? So the total number of people treated in Africa increased by 9.8 million people in 2017. However, it is still unfortunately the second leading infectious cause of blindness in the world. The mean infection rate was almost 40% as of 2004. And while not fatal, The blindness has been estimated to reduce life expectancy by between 4 to 10 years because of its debilitating effects. The Onchocerciasis Control Program had a study that was performed from 1974 to 2001 that determined that the attributable mortality risk was estimated to be almost 6%. Thankfully, there is no directly attributable deaths from onchocerciasis, but there are years of life lost. Upwards of 1.1 million disability-adjusted life years were lost as of 2015. As you can see, onchocerciasis is fairly low in its DALYs compared to many other neglected tropical diseases. Unfortunately, facility-based surveillance is not an effective measure and effective management of onchocerciasis. It was found to be ineffective due to the lack of hospital resources, especially in rural West Africa. And so more development needs to be done before it's considered a viable option for treatment of onchocerciasis. Community-based surveillance, however, has been found to be extremely effective. Community-based surveillance kind of technically began in 1987 when Onchocerciasis Control Program began distributing ivermectin through mobile teams. However, this was adjusted in 1995 when the APOC really began to look into community-directed treatment options. And by 1997, the CTDI strategy was found to be massively successful. And essentially the way that it works is that health workers from the APOC meet with the community, and the community decides whether to adopt the treatment approach, and they essentially decide everything from how and where the treatment is distributed to when it gets distributed. And at that point, all eligible people receive the treatment, and this process is repeated each year for between 16 to 18 years, which is what was determined to be the length of time needed to break the life cycle of the black fly and its larva. So here you can see how these community-based treatments are performed. They determine the doses based on height, and this is showing how they educate community members. Currently, the United Nations and the World Health Organization are two main organizations involved in onchocerciasis treatment and control. The WHO was the organization that originally founded the OCP in 1974, and together with the UN, UNICEF, and the World Bank, they actually founded the APOC in 1995. So as we've talked about before, the onchocerciasis is a parasitic disease caused by a worm that is transmitted through the bite of black flies. And once in the host, the larvae are transported through the bloodstream, and they live, the adult worms live in the skin and unfortunately, preferentially the eyes. And this repeated exposure over time increases the number of parasites. The best way to detect the outbreak is through the presence of the nodules in the skin, as well as the itching, and especially the lesions on the eye, as well as skin biopsy. So as you can see, on the left, we have the stages of the black fly larva through adult, and how they influence humans as well, and where the worms themselves actually develop. And then on our right, we have the epidemiological triangle for onchocerciasis. So as we said, our host is any human living near agricultural areas, and it's transmitted through adult black flies. The agent is our filarial worm, or our Onchocerca volvulus, and our environment is any agricultural area with little access to larvicides and the presence of a suitable fly species.
So there are two primary health promotion interventions that are taken to control the disease. The first one is mainly primary intervention, where there was an attempt to get rid of the vector entirely by using larvicidal insecticide spraying on black fly nesting sites. This was successful in majorly reducing incidences of infection. However, it didn't completely eliminate the presence of the disease. The secondary intervention, which is the core treatment used now, is CDTI, which is community-directed treatment with ivermectin. This started as a distribution by a pharmaceutical company in 1989 called Merck & Co. They started a donation program where they're mass distributing the drug. And this was actually really effective. In fact, it actually opened opportunities for potentially eliminating disease entirely. So in this treatment, elimination of disease was kind of regarded as an unrealistic goal until this was achieved in Colombia in 2008. They were actually shown to be free of the vector. They weren't able to find any infected black flies. The WHO has specific guidelines from 2001 to determine transmission status of the disease using serological blood tests, skin snip tests, and combined with etymology studies where black flies are caught and tested with PCR for the parasite. The recommended treatment regimen with ivermectin is at least once annually for 10 to 15 years, so quite a long treatment regimen. There are several health policy implementations that have been proposed by the government, mostly started in Americas, but now pushing into Africa, since success in eliminating the disease was first seen in the Latin American countries. Here's kind of a list timeline of resolutions that were proposed. There was a change in focus of actually eliminating disease entirely. As a clinical nurse leader, there's actually a lot of public health nursing opportunities in this area. Most likely you'll be working in the underserved suburban and rural areas where river blindness is seen the most. Interventions done are primarily primary and secondary in nature. There hasn't been a lot done for people who have already suffered morbidities from the disease, such as blindness. So, tertiary, there needs to be more tertiary support, which this area could use a lot. There's actually a study done in Nigeria where a couple of villages were studied for incidences of disease, and it showed about 40% of the community were actually infected, but the locals actually had a severe lack of knowledge in terms of the disease other than its manifestations. So there's a lot of opportunities for educational programs here to potentially promote prevention of the disease. Another role that the CNO has is assessing new and current cases of disease, basically following these patients that are currently infected with river blindness. Since the treatment regimen is so long, the CNO can help ensure compliance with the treatment and better patient outcomes. And usually in rural areas, there's not there's not a lot of access to healthcare delivery services. So CNO can help patients affected by the disease in getting the care that they need.